Thank my friend for yielding, and I agree with your sentiments. Mr. Chairman, this hearing calls to mind the classic line from Yogi Berra, it's deja vu all over again. This hearing really isn't about the difference between mandatory and discretionary funding. This hearing is really another veiled attempt to undermine the Affordable Care Act and prevent 30 million Americans from accessing affordable health coverage. According to the majority, the Affordable Care Act was, quote, unusual in that it created mandatory spending on programs that would otherwise be considered discretionary, unquote. It seems my friends on the other side of the aisle have a short memory. The Republican majority mandated open-ending spending on new programs in the Medicare Prescription Drug Improvement and Modernization Act and the Deficit Reduction Act, both of which have resulted in billions of dollars spent outside of the appropriations process, and worst of all, were unpaid for federal mandates. No jobs created by the majority, just tax breaks for the rich and big corporations, blowing a hole in the deficit, and again and again and again, day in and day out, attempts to repeal the health care law, which is already helping millions and millions of Americans. I yield back.
Minutes for questions.
Well, thank you, Mr. Chairman. I'd like to first ask unanimous consent to introduce for the record a letter from the public health commissioners from 10 of our nation's biggest cities, which provides great examples of the ways the fund is being used in our nation's cities.
Without objection, so ordered.
Thank you, Mr. Chairman. Mr. Chairman, Republicans have decided that this is the week to talk about mandatory spending in the Affordable Care Act. This has probably confused many Americans who thought that Congress was going to focus on creating jobs and reducing the deficit. I want to welcome our three panelists. I want to welcome Congressman Istuk back. But let's examine the issue of the Affordable Care Act's mandatory spending provisions. One of our colleagues, Michelle Bachmann, on Meet the Press last weekend, said that using mandatory funding was, quote, unquote, gangster government. And she said that this mandatory funding was the bill's, and again I quote her, dirty little secret. Congressman Istuk, you said to factcheck.org that this assessment was fair because these appropriations were, quote, and I quote you, not trumpeted loudly by sponsors of the measure, unquote. So I'm going to ask you in a minute to comment, but let's review the history here. For example, let's look at the Prevention and Wellness Fund. This is a critically important fund to provide stable funding for our public health infrastructure. The fund will support state and community efforts to prevent disease and make our nation healthier. Over 530 organizations have supported this fund because investing $10 per person per year on community-based prevention could save this nation more than $16 billion annually. I've never considered this a dirty little secret, quote, unquote. I'm proud of it. I've tried to trumpet it loudly. It was in just about every document we ever produced, every draft on the House and Senate side, every explanatory fact sheet, and every full CBO score. So let me read to you from our fact sheet. Quote, provides $15 billion in mandatory spending to support prevention and wellness activities, unquote. Does that sound like we're trying to keep this a secret? Even a fact book, factcheck.org concluded that, quote, no secret, Bachmann gets it wrong, unquote. And the Washington Post said, quote, this is bordering on ridiculous, and concluded that there is no bombshell beyond the bombast. But let's take this chance to learn more about the fund. I'd like to first ask Senator Vitale, according to healthcare.gov, organizations in New Jersey have received nearly $15 million in prevention and public health grants, from tobacco cessation programs to HIV prevention to public health infrastructure to primary care training. Senator, you mentioned in your testimony the idea of bringing primary health care services to people in their behavioral mental health setting. I'm told that people with serious mental illness die an average of 25 years sooner than the general population, largely due to untreated chronic disease. Can you tell us how bringing primary care and mental health together is actually an important shift in how we think about prevention?
Well, thank you for that question, Congressman, and you're right. It is an incredibly important way in which to bring the care to them. I think that, for a long time, a lot of policymakers, even state legislatures, have overlooked the importance of those mental health and substance abuse issues. And, in New Jersey, we have the same issues. And I was a little blindsided or dumbfounded by a comment by my friend Dr. Goodman that prevention really doesn't save money. I talked to any other healthcare expert in the nation that is learned as he is, that we would get a different answer. That prevention model is incredibly important. It means the world to people, even in terms of life and death. And so I would support those initiatives, and they make a whole lot of sense.
Thank you. This fund is much more than simply providing more funds for good things. It's about changing the way we think about prevention. I can't think of a better use of tax dollars than to institute proven prevention strategies that could save the taxpayers money. I just wanted to say, Dr. Goodman, not necessarily need a reply from you, but I was interested in your talking about the Massachusetts bill vis-a-vis the bill that we tried to put in. And I think you actually make a point many of us have been saying, that the fact of the matter is it's not fair for someone not to belong and then when they get sick opt in, because then everyone else's premium rises. That's why you have to have everyone being directed to mandatorily purchase insurance. And I find it really ironic that Mr. Romney, who implemented as governor the law in Massachusetts, which allows people to first get sick and then opt in, is now one of the people who's cracking the bill. Mr. Istuk, I want to give you a chance to respond. You replied to an inquiry from Fact Check that Congresswoman Backman's dirty little secret remarks against the government was fair, and you said these appropriations were, quote, not trumpeted loudly by sponsors of the measure. I tell you, we trumpeted it loudly, and I don't know, why you can say that we tried to hide it, but I'd like to give you a chance to answer.
If I may, Mr. Chairman.
Proceed.
Thank you. Actually, particular things have been checked both by Fact Check, by the Washington Post, and by PolitiFact. None of them had any criticism of what I have said on this. They had criticism of Ms. Bachmann, but not of my characterization. As I said, her characterization, I believed, was a fair comment and opinion. Just because something is well known to some people, such as yourself, does not mean that it has overall been well communicated to the American people. That is why I mention that we have a 2,700-page bill that is a huge haystack with a lot of needles still being discovered within that haystack. And I think the revelations are continuing, and that's part of what the chairman is seeking to point out during this hearing.
Thank you, Mr. Chairman.
Gentleman's time is